In a few moments, you will be introduced to the healthcare professionals who are involved in the HIE journey. The steps we take today will improve healthcare for future generations.
Health information exchange is the transmission of health information electronically between healthcare providers.
That health information exchange exchanges key pieces of clinical data among caregivers.
Doctor's Care just went through EMR, and it is a positive experience in the long run. It is a journey that involves your patient, your providers, your nurses, your admin staff.
I, as your care provider, need to know if someone else is treating you for a different condition, if you're on medications that you may not recall.
This is critical to behavioral health because it is vital to our clients' well-being to know what their physical health information is.
Sometimes it's really hard for us as clients, as patients, to remember everything we're taking.
We at Centura Health believe that sharing healthcare information easily and securely will improve the quality of healthcare the people of Colorado receive.
Requesting and copying and snail mailing of paper records does not meet the need.
Effective care management and the security of the record in a secure electronic record far exceeds anything on paper.
It'd be great because that way we can track our parents as they move from county to county or even from state to state, and they can get their records much easier that way.
But it is not a month. It takes time, and it affects productivity.
I also know how important it is for the clients that I care for to have their information available to care providers.
Ultimately, everyone is rewarded with a new room that has no charts in it.
Often when the paramedic arrives on the scene of a medical emergency, it's difficult to obtain accurate information as to the medical history.
If someone comes to us who is not able to communicate and we have not seen them before, this can be very problematic for us because we want to know key pieces of information.
It is useful for subsequent healthcare providers to have first-hand information of how the patient presented in the field.
It is extremely helpful for me if I'm working in the emergency room to be able to pull up what your allergies are.
As a nurse faculty member, health information exchange is very important for the faculty members and certainly for our students.
Often if a test result is not readily available, the test needs to be performed again, inconveniencing the patient and also driving up the cost of health care.
The most difficult thing for me is not having access to what other care providers may be doing or may have done.
When they can access the patient's family history, the patient history, the treatment plan, the students are able to better generate an effective treatment program for that patient.
This can greatly improve patient care as well as decrease costs by helping to avoid duplicate tests.
The health information exchange needs to be safe, it needs to be secure, but it also needs to be available when needed.
But the quality of care and the data that we have on our patients that exists electronically is phenomenal. It's been a positive experience in the long run, but it is a journey.
Please join the South Metro Health Alliance on Monday, November 5th at Porter Adventist Hospital, where we will convene experts in this field and have meaningful discussions and resources available to help you in your journey.